Hello, this is Dr. David Green, CEO of the Texas Pain Network. The topic today is avoiding surgery for degenerative disc disease. When you look at the normal intervertebral disc, it consists of 80% water and then 20% collagens and protein. There are two layers, and the analogy is that of a jelly donut. So you have this harder outer annulus fibrosis layer, which actually does have nerve endings, so it can feel pain if it's damaged. The inner gelatinous layer is known as the nucleus pulposus, and this has no nerve endings at all. The disc overall is a great shock absorber. Every time we walk, jump, bend, pressure goes through the disc space, and it just gets squeezed and pushes water out, and then it comes right back in. As a disc starts to degenerate, the main thing that happens is it loses water content. So you go from 80% and it starts to go down. You can lose height. So here you have a healthy disc, and then you start to lose height because the water content is gone. And it can also start to bulge. That's how you get a bulging disc. It's almost like a tire that's getting flat, right? You start to lose height and it starts to bulge out. Pain can occur from this degeneration if the resulting tears and cracks occur in the annulus because they do have nerve endings there. Studies show that 40% of the time, back pain is a result of something going on in the intervertebral disc. It may cause inflammation and irritate adjacent nerve roots, and that is known as sciatica. Degenerative disc disease may lead to daily disabling pain, or it may cause no symptoms at all. There was a study done years ago that showed that 35% of individuals between 20 and 50 have degenerative disc disease on an MRI, but had no symptoms whatsoever. So just because you see a black disc that's losing water doesn't mean it's going to hurt an individual. Treatment options may include over-the-counter medications such as anti-inflammatories and Tylenol. Short-term narcotics may be extremely helpful during periods of exacerbation. Topical treatments such as prescription pain patches or prescription pain creams can be exceptionally helpful. Muscle relaxers, physical therapy can usually be very helpful. Chiropractic treatment, TENS units, spinal decompression therapy, such as you see here, involves a computerized intermittent traction that helps to bring a negative pressure into the disc space, bringing nutrients and oxygen and blood flow in to help with healing. Acupuncture can help as well. When it comes to interventional treatment options, there are several. For muscle spasms and aching, trigger point injections are great. Intradiscal, which is where you actually go literally into the disc with an injection, have actually been shown to be very helpful. They're not hard to do, and when a pain doctor injects steroid, there's actually some studies showing that can be extremely helpful for months. A lot of times when you have degenerative disc disease, you end up having problems in the facet joints in the back. So facet treatments, such as with a medial branch block, a facet injection, or even a radiofrequency ablation, can provide exceptional pain relief when a person has degenerative disc disease. If a person has a chemical inflammation from a degenerative disc, then you can end up getting sciatica because it irritates the adjacent nerve roots. Because of that, an epidural injection can be very helpful. An IDET procedure is known as an intradiscal electrothermal treatment. That is not done very much anymore because insurance companies stopped paying for it because it didn't work very well. It was just basically heating up the disc itself. Mild is minimally invasive lumbar decompression. That's done as a cutting-edge procedure, and that can help decompress the disc and provide pain relief. Here's a radiofrequency ablation procedure for those who have not just disc disease but arthritis in these facet joints. This procedure provides thermal energy and heats up the area where these little nerve endings are. It can deaden those for up to 18 months and provide exceptional consistent pain relief. Additional treatment options include stem cell injections. Here you see a bone marrow aspirate being processed in real time in the room where the patient is. This is basically stem cells, which are great because they can help repair and regenerate as opposed to just providing a Band-Aid like a steroid injection. Comparison of long-term outcomes for those with back pain and a concordant discogram did not demonstrate a significant difference in outcome measures of pain, health status, satisfaction, or disability, whether or not the patient had a fusion or non-operative treatment. Okay, 3/4 of the time, patients are able to achieve a satisfactory level of baseline pain with degenerative disc disease and avoid surgery. The top pain management in Texas is through the Texas Pain Network. There's several clinics throughout the state. Over 50 insurances are accepted and over 25 treatment options are provided. There's over 90% average success rates at the various clinics with the board-certified, award-winning pain doctors. Visit us today at texaspainnetwork.net. If you or a loved one has back or neck pain or any other type of simple or chronic pain condition, please call us at 877-877-8556 and we'll help you. This is Dr. David Green with the Texas Pain Network. Your pain stops here.